Hello, folks. My name is Peter George. I'm here to talk to you about what I've endured in being a three-time cancer survivor and what I'm about to endure with a bone marrow transplant from another donor. I hope that what I'm doing here helps people out to see what somebody like me goes by in a day-to-day basis when this bone marrow transplant is happening, or what you can expect to go through when you're doing this. A brief history. About 5 years ago, I found my first cancer. I was going on a ride from a 5-state ride on my motorcycle from Miami to Alabama, Tennessee, all the way around. It was a great ride, but I was sick as a dog the whole ride. I maintained to finish it, came back, went back to work. 5 days later, I checked into a urgent care center. They sent me to a hospital because they said I was close to kidney failure. Long story short, I had stage 4 non-Hodgkin's lymphoma all around my abdomen. They, of course, treated it with chemotherapy. The chemotherapy worked, killed the non-Hodgkin's lymphoma tumors, and then went ahead and burnt holes in my intestines. Those holes that were burnt in my intestines led to a septic infection in my stomach, which ended up in an emergency surgery, me wearing ostomy bags for about 6 months. Then they sewed me back up, and I went ahead on with my life. I thought it was good. I had beaten it. It was a hell of a thing to do, but I was beating it. I had proud of myself. All my friends were cheering me on. 5 months later, the non-Hodgkin's lymphoma came back right here in my parotid gland. Another chemotherapy session, stronger than the first. The tumor went away, and my oncologist thought that I should go ahead and become a candidate for a stem cell transplant. That stem cell transplant was, of course, with my own blood being donated, filtered, stem cells frozen, and then we proceeded with the transplant. That was quite an ordeal. That was a very strong chemotherapy because what they do is they totally knock out, or almost radically knock out, your bone marrow, your immune system, and then they take the frozen stem cells, they put them back into your body, and they graft back, and you get a new immune system, and hopefully you'd be cured for the cancer for the rest of your life. That was the goal. Well, I was great. I was doing real great. My newborn on date, as they call it when you receive this type of transplant, was October 3rd of 2011. I was doing really, really good. I was happy for myself. Here I am, a 2-time cancer survivor. I survived that stem cell procedure, which was terrible. And last December, right around the holidays, I checked myself into the hospital because I wasn't feeling good. The reason why I checked myself in is, first, I was short of breath, thought I was catching a cold or something. Then I got numb from here to here. The whole bottom jaw was numb. And I said, why has my neuropathy gotten to my jaw? Again, for you that don't know, peripheral neuropathy is a side effect of chemotherapy. Your feet go numb, your legs go numb, your hands, depending on where it hits you. So that really scared me, and I went ahead to the emergency room. They checked me up and down. I was in the hospital for 11 days. They CT'd me, they PET scanned me, they MRI'd me, they biopsied me. They did everything you can possibly imagine, and they found nothing. They removed fluid from my lungs. That's about it. And they said that that was just probably the neuropathy as a result of my prior chemotherapy spreading to my jaw. Okay, fine. About a week later, still felt like crap. Checked into the hospital. They did a PET CT scan, this time with contrast, and they found cancer, the non-Hodgkin's lymphoma again, but this time very aggressive and everywhere. It was in my liver, it was in my spleen, it was in the walls of my lungs. It was scattered around my abdomen. And last but not least, it crossed into my nervous system, and it was in my cerebral spinal fluid. So that was pretty bad news. From what I hear from people who saw the scans and stuff like that, they were pretty much kissing me off. Now understand, the first time they kissed me off, and I beat that. The second time wasn't that bad. They said I'd do it. The stem cell transplant was a 50-50. I did it. But this time they said, forget it, he's too weak, he's not going to survive this treatment. But guess what? I survived the treatment. That included installing something called a myoport. You can see it right here on my head. And what they did is they put a port in there to inject the chemotherapy into your cerebral spinal fluid to attack the non-Hodgkin's lymphoma that was in there. Everything else cleared up. It took 6 chemotherapy sessions of R-EPOCH, I believe it was called. And the R-EPOCH was very nasty. It was in the hospital for 5 days, out for 3 weeks. That's the way the whole thing went. And it was 6 sessions of that. Between the 4th and the 6th session, I went back to the University of Miami. It's all about the U. And they went ahead and they suggested, Dr. Burns and his good folks over there, they suggested that this time I went ahead and do a bone marrow transplant. Of course, since I have no siblings and my daughter can't do it as well, and a lot of other stuff, I went ahead and signed up, and they looked for a match on the National Registry for bone marrow donors. Thank God they found one, a 9 out of 10 match, which is good because they want to have something called host versus graft happen. So the new bone marrow that's going in basically scrubs your entire system, looks for the last little bit of lymphomas, eradicates it before it establishes itself as your new immune system. So that being said, and I hope I wasn't too lengthy with my words, a week from today, I'm going to be going in to the University of Miami Sylvester Center Bone Marrow Transplant Center, and I will be having this bone marrow. I'll be in the hospital, this bone marrow transplant from an unknown donor, and I will be in there between 30 to 45 days. I always wanted to find out what I can do to help people in my condition. I've done little things here and there. I've supported people that I know. But hopefully my goal with this video, and this video blog actually, is to go ahead, and anybody who's getting ready to go through what I'm going through, or who has been through what I have been through and want to see what's going, or for whatever reason, they can see it here, know what to expect, and if you have any questions, you'll be able to email me in an email I'll give you at a later date to go ahead and try to help you out. I just want to help. It's not an easy thing to go through. The number one thing you need is a good attitude about it. You got to stay positive. You can't stay negative. I had a little bit of a bout with depression, knowing that this was the next time that it was coming up. But you know what? Life goes on, and I got to go ahead and do it. So anyway, I hope this really helps. I'm going to try and tag this video under bone marrow transplant, cancer survivor, whatever I can do. And today is, I don't know, but 7 days from today, on September the 4th, I will be going into the hospital to begin the procedure. The day before, they're going to go ahead and install the port to be able to go ahead and apply all the medications they need to apply to me. That's when I'm coming back to you. I'll come back next Wednesday and go ahead and before and after the procedure of installing the port. And then I'll be back on Thursday when they put me into the hospital. And God willing, I will be there every single day of the transplant until I go home. And I really, really hope and pray that this helps somebody out there in my similar situation. All right, folks, so this is Peter George signing off, and I'll see you in 6 days. Bye-bye. Oh, and one thing I forgot to say. I will be sharing this on my YouTube channel. It's Peter George. So when you see this video, just subscribe to it so it's easy to come to. And I will also be sharing it every now and again to Facebook. So again, I hope this helps, and wish me luck, y'all. Bye again.